So my topic is impact of nurse-led teleconsultation strategy for cardiovascular disease management during COVID-19 pandemic in India, a pyramid model study. I have nothing to disclose. So in India, telemedicine is not widely used due to inadequate guidelines and legislation. But COVID-19 pandemic necessitated the use of telemedicine to maintain the continuity of care with the patients with cardiovascular diseases. This study aimed to demonstrate the feasibility of implementing the nurse-led teleconsultation strategy for cardiovascular disease management during COVID-19 pandemic, and further to evaluate the patient treatment satisfaction for nurse-led teleconsultation versus physician-led teleconsultation. So the study period was 1 month immediately after the nationwide lockdown, that is 26th March 2020 till 25th April 2020. So this was the study period, and the target population which was dealt with was the all cardiovascular disease patients who visited the Department of Cardiology, both IPD and OPD patients in the last 6 months before the nationwide lockdown. And the patients without valid contact numbers were excluded from the study. We use the three-tiered pyramid model for this study. So in stage 1, which was done by nurse-led teleconsultation, formed the base of the pyramid, and the stage 2 was the physician-led teleconsultation, which formed the waist of the pyramid. And subsequently, very less number of patients were subsequently referred for nearby hospital tertiary level for the tertiary level care. The stage 1 was formed by 36 nursing staff, and stage 2 by the team of 7 physicians. So as per the government guidelines, 1 week teaching session were used to standardize our treating protocols and to improve their understanding about teleconsultation principles. So we could retrieve the data for 12,000 patients who were supposed to be visiting after the lockdown, out of which OPD visits were 7,000 patients and 4,800 patients were the IPD patients. So this was the study population, and these were the 6 months prior to the start of lockdown. We did the teleconsultation protocol on this, and the stage 1, 36 healthcare workers collected the responses of these 12,000 patients on the basis of preset questionnaire using telephone as the tool, and communication mode was real-time audio interaction. This formed the base of the pyramid, and the patients went on to stage 2. 758 patients were referred to the physician-led teleconsultation in view of predefined critical issues mentioned in the questionnaires. And that formed the base of the pyramid, and out of those, 64 patients were referred for the admission to the nearby tertiary care centers that form the apex of the pyramid. So this was the questionnaire which included the symptoms in the form of chest pain, palpitation, breathlessness, fatigue. This was done by at the level of stage 1 by the nurse-led teleconsultation, and it was on the Likert scale of 0 to 10, being 0 being worst and 10 being good. And the blood pressure was which was measured in the last 1 week at the time of teleconsulting the patient. And the preset defined critical value of blood pressure, which was found to be more than 160 by 100 by 100, then the patient was referred for the stage 2 teleconsultation, that is physician-led teleconsultation. Similarly, blood glucose level, if it was more than 300 milligram per deciliter, it was found to be critically high, and patient was referred for the stage 2 teleconsultation. And other parameters were also asked as mentioned in the questionnaire. So this was the data which was generated by the stage 1 nurse-led teleconsultation, wherein we can see more than 40% of the patient were hypertensive and diabetic, and among hypertensive, 1.6% of the total cohort patient amongst hypertensive, and 2.8% of the total cohort had a critically high value of blood pressure and blood sugar level respectively. So this is the table showing that we identified about 6.6% among the diabetic patient had a critically high sugar level, and 3.5% among hypertensive patient had a critically high value of blood pressure were referred for the stage 2 teleconsultation. This was done at stage 1 teleconsultation by nurse-led teleconsultation. So going to the stage 2, which is a physician-led teleconsultation, it was found 758 patients were consulted and 16% of the patient had a symptoms related to congestive heart failure. 6.7% of the patient had ischemic heart disease related symptoms, and we can see about 18% patient had uncontrolled critically high level of blood pressure. That is why they were referred to second stage of teleconsultation, and about 25% odd patients had uncontrolled diabetic status. And we can see 64 patients among these 758 patients were further referred for a nearby to asked to visit a nearby tertiary care center because they were sicker. So apart from this, we needed to perceive the treatment satisfaction level between the nurse-led versus physician-led teleconsultation. So this was done by randomly selecting the subsample of patients from the study population. About 1,000 patients were selected and they were subjected to nurse-led teleconsultation and physician-led teleconsultation separately. So and they were asked a form of questionnaire of a modified version of treatment satisfaction questionnaire for medication, that is TMSQ, with a scale of 0 to 6, 0 being fully satisfied and 6 being unsatisfied. So we can see in this particular graph, most of the patient, that is more than 90% of the patient were fully satisfied with no significant difference between the nurse-led teleconsultation and physician-led teleconsultation, thereby saying that the treatment satisfaction level was similar between both stage 1 and stage 2. There were two major limitations for the study. One was it was the only audio mode was used and it was a single center implementation telemedication study. So thereby the study demonstrated the feasibility to implement the pyramid model based nurse-led telemedication in COVID-19 pandemic. And it also showed the patient treatment satisfaction level between nurse-led versus physician-led teleconsultation. So this was the first study to demonstrate the nurse-led teleconsultation strategy to provide timely and effective cardiovascular care during COVID-19 pandemic in India. And a novel 3-tier pyramid model was created to expedite the process of teleconsultation and to reach out to a larger number of cardiovascular disease patients. Therefore, such a pyramid model of teleconsultation could be considered for a routine care beyond the pandemic and even in the post-COVID India. Thank you.